Concussion baseline testing in high-risk contact athletes. How do we use it for return to play decisions? I'm Dr. Mark Eisig. I'm a naturopathic physician and a concussion specialist. Today we're going to talk about baseline testing in the context of high-risk contact sports. So what's it good for? What is a quality baseline test? How should we think about baseline testing? So I'm going to be going off some notes on my computer here, but one of the first things that I want to say is baseline testing is not for the diagnosis of concussion. It's actually for the return to play decision. So baseline testing is not for the diagnosis because the diagnosis in sport is relatively easy. There's a mechanism of injury, so someone got hit, their head hit the turf, a puck hit their head, something happened that looked concussive. They went to the sideline, they had symptoms, they didn't pass their SCAT-5, their King-Devic, their VOMS, their whatever, and concussion diagnosis is likely. So that's really the easy part. The tricky part is wondering and knowing confidently, is this athlete ready to return to play? And that's where baseline testing is really important for that step. We need to know before letting you go back to sport, back on the ice, back on the field, that you've tested out and are actually as good as you were or better than before your concussion, so that we know that we're not going to put you at risk of another injury. And it's really important that we know that it's you versus you versus the general population versus normative data. So what is you versus you baseline testing? You versus you is exactly what it sounds like. It's you preseason testing against, or you after the concussion testing against you preseason. So normative values are actually like how you would compare to the population. So normative values would compare you to other 15 to 18 year olds, 18 to 25 year olds, what that general population looks like. But when we're using averages, for most cases, we might as well flip a coin when we're making return to play decisions. When it's you versus you, like I've said several times, we're comparing your post-concussion scores to your preseason scores, to your baseline scores, and not averages or norms. So for example, I'll put a little flow chart up here on the screen, one of these sides. Let's say we need to determine if your balance is back up to game-ready preseason levels. Let's compare if we were using norms versus if we were using you versus you baseline. So we've got athlete A, and they've got great balance. On their baseline testing, they've got great balance, and they're in the 99th percentile of norms. Athlete B has poor balance at baseline, and they're in the 15th percentile of norms, right? So they, after a concussion, we test them and we're using normative values. We return athlete A back to sport because their balance has hit the 85th percentile based on normative values. Athlete B, we don't actually return back to sport because their balance is stuck at the 40th percentile based on normative values. Do you see the problem there? So what we did is we returned athlete A too early. Normally they're the 99th percentile, and we return them when they're at the 85th percentile. And we actually held athlete B back even though they had better balance, like notably better balance at the 45th percentile compared to their 15th percentile at baseline. So we really want to be able to compare you versus you so that we're sending you back at the right time for your performance. And we really want to be able to compare multiple metrics when we're doing this. Why multiple metrics? Concussion impacts your physical, your cognitives, your mental, and your emotional domains of your experience and your performance. And we need to make sure that you're back to baseline so you don't risk repeat concussion or a secondary orthopedic injury. So the problem is that most sports programs, most youth organizations use just a SCAT-5 or just an impact test. And sometimes they'll do both. And that's not enough. It's actually advised against doing that in the research. It's recommended doing a multimodal approach to baseline testing, but despite this, still 70% of US high schools only use an impact test. The problems with the SCAT-5 and just using a SCAT-5 is that it normalizes within about 3 days of the injury, whether you still have symptoms or have recovered or not. And you're not going to recover within 3 days. So the SCAT-5 normalizing is not useful. The problem with the impact, when we use normative values on the impact, we literally might as well flip a coin. It's about 50%. And it's not validated in kids under 13 years old. There's also the limitation that these are neurocognitive tests. And they're performed at rest, while sport is actually performed under sport kind of exercising conditions. So we need to look at other metrics. We need to look at things like reaction time. Reaction time can be impaired for 21 to 59 days after injury. We need to look at neurocognitive, visual, vestibular, and balance parameters because those can be impaired for 3 to 4 weeks after the injury. So when we're using just a SCAT5 or just an impact or even combining those, it's not enough to make a safe and robust return to sport. So quality baseline testing, what does that actually look like? Quality baseline testing is going to include a SCAT5, it's going to include an impact, and it's going to include a King Devic, it's going to include reaction time, and ideally it's going to include a force plate for postural sway to objectively track your balance. So SCAT5 and impact, they're really useful because they're neurocognitive tests and they can be used for the tricky diagnosis of concussion. So someone where you're not sure, was that a concussion, was it not? This can help you rule it in, and it measures neurocognitive parameters. The impact does measure neurocognitive parameters really well, but not completely enough, which is why you want these other metrics. King Devic is the only test in here that actually tests visual processing speed. So a drop in your King Devic score by about 5 seconds is indicative of concussion, so it helps with the diagnosis. But then it also helps with return to play because it doesn't normalize sooner than recovery. So the SCAT5 normalizes in 3 days. The King Devic can be used throughout recovery, so that's really a useful test. Balance is actually tested via the BESS in the SCAT5, so the balance area scoring system. You stand 20 seconds, hands on the hips, single leg, tandem. But the problem with the BESS is that it normalizes within a few days as well. So for balance, we actually want to throw in a force plate and measure postural sway because we can objectively quantify your balance and we can track it throughout the course of recovery. It's not going to normalize faster than you do. And then reaction time, again, that can be delayed 21 to 59 days, and we're measuring your reaction time. Your reaction time could be the difference in preparing for that second concussion or not. And we know that that can take 21 to 59 days to normalize, so we want to test it. We want to make sure that we're sending you back. We use drop stick testing, which is why I'm doing this. We want to make sure we're sending you back at the appropriate time. And there's also different things. There's simple reaction time, choice reaction time, discriminative reaction time. So we want to make sure we're doing dual tasking and different things to make sure you're back to sport, but that could be a whole different video. And the last thing to keep in mind before we wrap up this video is that with baseline testing, ideally to return to sport, because you're a hockey player, rugby player, lacrosse player, soccer player, football player, whatever, to return to contact sports, none of this baseline testing is done at complete rest. Ideally, there's an exertion protocol and then baseline testing. We want to fatigue you out under game-like conditions and then see if you can neurocognitively perform under reaction, balance, posture, all those things. When we do this, we'll actually catch 28% of people who are cleared using other means at rest. So we'll actually catch 1 in 3 athletes who are not ready to return to play when we do exertion testing. So baseline testing is really for return to play. It's not for diagnosis, and it needs to be multimodal, not just computerized, not just the SCAT. We need to actually test physical balance, other neurocognitive parameters, and ideally under a state of exertion. So if you like this video, go ahead and give it a thumbs up. And if you want to learn more about concussion, PCS, return to sport, go ahead and give my account a follow. Thank you.